Jamal Murray went down with what looks to be a pretty concerning left knee injury here on this play in last night's game. Welcome back, everybody. I'm Dr. Brian Sutterer, and this is your #1 source for learning about the unique medical side of the world of sports. Let's just get right into the play here. You guys know to subscribe and hit the thumbs up button if you enjoy it and all that good stuff. So here we can watch Murray driving down into the lane and keep an eye on his left side because that's what was injured. So here as he goes and puts all his weight to plant and sort of cut a little bit on that left side, we can see this ever so slight little bit of shift kind of in his knee where it goes just this ever so slight bit inward. And it's even just like 1 frame difference. If I go forward 1 frame here and then back, that single little shift that we see there, you can see how there's change all the way starting down in the ankle that's going to run all the way up that tibia into the knee and then up into the hip. And what it looks like is basically occurring here is there's a little bit of internal rotation of his tibia, meaning his tibia kind of rotates inward a little bit, as well as that knee kind of falling inward at the same time. He then goes on, the rest of the play pushes off, and then as he comes down, we can see he was already in pain, and so it was clearly on that push off where he got hurt. This is kind of the classic position that we see of an athlete who does some sort of cut pivot, feels a pop in their knee, and then has an ACL tear. Now, we saw something like this with Wiseman, right, where he went up in a position, came down, looked to be compromising for the ACL, ended up being the meniscus. So we still do have to keep those other things on our differential here, and a lot of it depends on the very minute biomechanics within the knee joint that are going to determine whether this is something like the ACL, something like an MCL injury here on the inside of his knee, or something like the meniscus. I will say the fact that Murray reacted like he did makes me suspect more ACL as well. A lot of time guys will have a very clear moment where they feel a pop, they feel something in their knee, and they kind of react in a very strong way. I want to go back and look at when Derrick Rose tore his ACL because I think it gives you a little bit of a sense of how subtle some of these movements can be with the knee. So here was Rose as he was driving in, it was his left side, and as he does this hop step here and plants, right there, all right, it was that subtle, small, tiny little bit of the knee coming inward right at that little moment that was ultimately right here when Rose tore his ACL. So you don't have to have this big contact coming into the side of the leg. It can be these subtle little shifts, these subtle little rotations that cause that ACL to tear. If we look at our biodigital anatomy tool, we can understand the positions of why that ACL can be injured. Of course, I've got the ACL shown here with the femur transparent, and the ACL runs #1 from the front to the back of the knee, and then it also runs from more the inside of the tibia to the outside of the femur. That diagonal pattern that it takes means that essentially if anything internally rotates the tibia and basically pulls the tibia around this way, that's going to stretch the ACL even more. If you then have a position where the knee comes inward, that's that dynamic knee valgus, that's going to pull the ACL even more. And so it's oftentimes the combination of those two things, that internal rotation, that knee abduction, and then you're also going to have a little bit of the femur kind of coming the other way. So when we go back to Murray here, he plants. As he plants, that ACL is immediately going to be loaded in that position. The dynamic stabilizers can't support it with the different muscle controls, and all that load gets put through the ACL. We can see ever so slightly a little bit of what looks like kind of shift inwards of the knee here right as he hard plants. And I think this position is going to be when my concern is he tore the ACL. There's not as much twisting on a bent knee that we see with something like a meniscus, but still on the list for differential. Same thing with the MCL. Not exactly common, but still going to be high up there on the list. Sometimes you can sort of read the tea leaves in the room on these kind of things because it's pretty easy to pick up if somebody has a torn ACL right there in the moment with our physical exam tests. And sometimes we'll see stuff leak about the organization fears it's an ACL tear before they even get the MRI. Certainly the sense from the Nuggets is that there's concern, but they haven't really leaked any of that specific stuff out yet. It's possible he could have had just a sprain or a partial injury to one of the ligaments. And I've got my fingers crossed hoping that it's just something like a meniscus or the MCL. Now, both of those could still keep him out for the rest of the season, but they wouldn't be as detrimental to the rest of his career. So we'll see what the MRI shows with the final diagnosis. That's it for the video. I hope this was educational and you learned something here about what happened with Jamal Murray and the anatomy of our knee. As always, let me know any questions or comments down below. And until next time, we'll see you later. Bye.